Alrighty. Hello, everyone, and welcome to this month's APTA Social, Building a Successful PTA. My name is Zofia Hack, and I serve on the APTA Student Board in the role of Nominating Committee Chair-elect. Before I pass the mic off to your host this evening, I'm just going to go over a couple of house rules before we get going. So first of all, please keep your microphones muted at all times unless you're asking a question in order to be respectful to our hosts and panelists. To ask a question, you can either raise your hand or send them in the chat, but we want this event to be as interactive as possible tonight. So please know that a raised hand will be answered first before the chat questions. If you feel comfortable, please turn your camera on. And as the conversation goes on, if you hear anything particularly interesting to you, please use the hashtag APTA Social to continue the conversation on social media after the social is done. And at the end of the event, we'll go into some smaller breakout rooms. And this time we want to try something a little bit different, designed to help you further get to know your PT and PTA counterparts, which I'll explain further during the announcements. And you'll also be able to ask any further questions you have to our panelists, as well as network with other attendees. In preparation for this, and so that we get a good mix of PTs, PTAs, SPTs, and SPTAs in the rooms, please add your title to your name on Zoom if you can. So as you can see, mine says Zofia Hack SPT because I'm a student physical therapist. So try to do something similar with your title on Zoom if you know how to do that. If not, maybe I can try to help you in the chat. Now, while we're waiting for a couple stragglers to trickle in, we would love to take a group picture to share on APTA's social media. So everyone, if you're comfortable, please turn your camera on if you would like to be in it, and say cheese while I try to figure out how to take a screenshot on my Mac and get everyone in it. Gonna be tough to get everyone.
Might have to do a couple, Zofia.
Okay, I'll do a couple. All right, everybody ready? Taking them now. All right, got a lot of people here tonight. So without further ado, I'm now going to turn it over to your host this evening, Maya Zelser, who is rocking it as a PTA student leader in California. Maya, take it away.
Hi, everyone. I'm so happy to be here and to see a lot of familiar faces. So thank you for coming. I am an SPTA in California. I go to CBD College. I'm also the SPTA chair for California's Student Special Interest Group. And I wanted to say thank you to Zofia and the rest of the APTA nominated committee for inviting me here today. I wanted to do a couple quick announcements for people who are joining us from California. The CPTA has our annual conference coming up at the end of September. So I'm going to put in the chat a link to register for this conference. All of us in the California Student Special Interest Group will be there, so we hope to see you there. We also have a webinar coming up for CASIG. It's going to discuss the patient-provider interaction, and that's going to be August 11th. So if you're interested, this webinar is free, similar format, Q&A, and we'll have an awesome speaker from West Coast College discussing this relationship. So today we are joined by awesome PTAs. I'm super excited to start the discussion today. Starting with Margie, if you would mind introducing yourself a little bit for students who may not know you.
Hi, everyone. My name is Margie Nguyen. I'm a PTA in Northern Virginia, right outside of DC. I'm currently a home health physical therapist. Thank you for having me on today.
Awesome.
My name is Ted Thompson. I'm a PTA recent graduate after last year, so I've been working since September. I'm also in Northern Virginia, a little further west from where Margie is. I'm in Fairfax, which is just outside the Beltway, but also like 30 minutes from the city. I'm an outpatient ortho as part of Innova's the hospital network in Northern Virginia. So that's what I've got.
Hi, I'm Brenda. I'm Brenda Dorman, and I'm in Florida. I'm not anywhere in Virginia, so I'm nice nice down south in Florida. And I've been a PTA for 20 some years. I work in a neuro outpatient facility that's associated with a level 1 trauma hospital. And I have a number of leadership roles that I've been in over the years, most recently the one as a PTA caucus delegate. So I'm super excited to be here and chat with you guys.
So thank you, everyone. So just a reminder, we encourage questions from the audience, so you can put it in the chat, or if you prefer, raise your hand and say your question out loud. I'll start us off with the first question. Just like, you know, the title of our webinar today is about the PT-PTA relationship. So I would like to ask the panelists on what's the most memorable PT-PTA relationship you have had. And while you think about it for a second, I just wanted to share mine real quick. And mine is, not to put you on the spot, Zofia, but Zofia, who's an SPT in Florida, is why this event is happening today. And we've been discussing about highlighting PTA involvement. So while we were first discussing, one of the first emails that she said to me was, if no one has told you recently you are a rock star and your efforts are not going unnoticed, the world needs more motivated people looking to create change like you. So I wanted to share that, and that's my most memorable PT-PTA relationship, and kindness goes a long way. So I think that's a good place to start. So Brenda,
I'm gonna cry.
to start.
All right, this is like a tricky question because I have lots of years of experience with amazing PTs that I have been working with over the year. I think there's two that stand out with me. One is the one that I've worked with since I first started working. Leslie is an amazing PT that never once in her life treated me anything other than a collaborator, a team player. She never once spoke down to me. She never once treated me like I was her assistant. You know, it was just, I was part of this team, and she really relished my knowledge. And the one most recently is my PT partner, Marissa. And so she was interesting. A little shout out to UCF. Whoop, whoop. She was a recent grad. And so she came into our outpatient setting with not a lot of experience. And so, you know, like always, it's all about the patient, right? So I'm just like, you know, yeah, what can I do to help? What can I do to help? What can I do to help? And she was just always like, oh my gosh, what do I do without you? What do I do without you? And it was such a great collaboration because like I kind of told her the goals I wanted, and she would give me the goals I wanted, and we would collaborate with this patient care. And so she'll give me patients that she knows. She's like, I know you could do so much better. You know, I'm going to, you know, tell me the goals and let me be here for you, and always treat me with respect. So those are like the two. And I've had a lot of great other ones, but I mean, those are the two, if I had to say, most memorable. And I've had some bad ones, but we won't talk about that because we're going to keep this positive. And I'm going to pass it off to Margie.
Thanks, Brenda. I think my most memorable PT-PTA relationship started off when I was a student and my CI, and then he turned into a coworker, colleague. We were treating a patient with shoulder dysfunction, and it's been like 2-3 weeks. There's not really much progress. And I asked him, like, do you think it could be thoracic outlet syndrome? And he was like, you know what, we kind of breezed through that through school. I don't really remember what that is. I turned my in-service into thoracic outlet syndrome, presented him and the staff with some information. And at the end of the presentation, he told me, you taught me something I didn't know. And we changed the plan of care together to collaborate with the patient, a better outcome for the patient. Just like what Brenda said, never treated me any differently, even when I was a student. You know, we're colleagues, we're teammates. We don't work together anymore, but he's still my mentor. I reach out to him when I have any kind of career advice needs. And it was just someone really easy to talk to about PT or not about PT. I'll pass it to Ted.
Thanks, Margie. I think that like the team that I work with right now is really amazing. That I don't have like a favorite moment from them. I will say though that what I love about it is that there is no pretentiousness, there's no ego. The communication is really easy. they'll come to me and say, what are your thoughts on how do we do this? Or they would just come to say, hey, so-and-so, this patient is kind of a challenge. They would just kind of give you the heads up and let you work from there. So collectively as a whole, the communication of where I am right now is the best team I've worked with in all of my years in both, well, my not so year as PT, but within public accounting, which is my past. But I do have a moment when I was just in my clinical rotation. I was at a skilled nursing facility in Virginia. My CI was Susan Geiger. She is a DPT that we had to interview there before they would actually accept us in to be a student there. They wanted to make sure we were aware of what we were getting into. And you don't really know what you're getting into when you go into a skilled nursing facility, because every day something crazy could happen. We had a patient who the PT that did the eval, it took her, I want to say 3.5 hours. She couldn't finish it. She came back to the room crying. And so the next week, Susan and I went in to work with this patient. And it was clear right off the bat that this patient did not want to work with women. And it was that he was a very proud, very successful older gentleman who felt that his life deserved, like he didn't want to be humiliated by working with women. He just was very proud. And so Susan was like, you got this, Ted. And I loved that trust that I was a student and I had been working with her for maybe 2 to 3 weeks, that we came across a very difficult patient. And I loved the trust that she was like, I think that you're fine. And I want to say that like all of the like lifting posture that you train for, there are certain times where that doesn't, throw it out the window. You're just trying to get somebody out of a chair. And I'm pretty sure that if I was any less lucky, I would have like thrown out my back this first day and trying to stand up somebody without any assistance because Susan walked out of the room. But I love that trust. But in all the relationships, it's that communication and having that common goal that your patient is the objective, not anything that you do. It's just that we want this patient to get better. I've loved all of it.
Thank you. Yeah, that's awesome that you guys have had such positive experiences. Not to focus on any negatives, but I just wanted to know what is your response if a PT might not understand your knowledge or your scope of practice? Or have you had an experience where you've had to explain kind of your abilities a little bit?
I'll start with that one. Okay. Oh, all right. I think that because I work with a lot of new DPTs, so several of the women I work with have just graduated, and they don't necessarily know the training that we've gone through. But again, it's just that open conversation. The fun part is that we have students coming in to volunteer, and that we talk about like what are the differences between the PTs and the PTAs. And it's always fun when you say that, oh yeah, PTAs do this, and they're like, oh, I didn't know you could do that. And those moments are just kind of fun. It opens up those little windows into helping people understand what our role is. All right, Brenda, take it away.
I guess what I do is whenever there's a new PT that comes on board, I'm just like, I am your biggest asset. I'm going to make your job so flippin' easy, and I'm here for you, and I got your back. So I've not had to educate that much. I do reiterate that I can assess, right? Most of them know that. So I've had a few instances early on where I had to kind of say like, yes, I can assess that, and I can give you information for you to progress the plan. So there was that. I find it's always interesting when we do like PT-PTA days and we're in big environments with PTs, just that general knowledge that I'm telling PTs that yes, PTAs can do a home exercise program. Like that's fascinating, but yes, we can do that. So it's been these little treatment things along the way. But I just tell my partner, like I can assess your goals. You tell me what you want to discharge that patient. I'll prep you for the discharge. Like I'm here for you. And I just let them know that I'm like just part of your teammate, my knowledge, and I say this to patients all the time and they all laugh. And all my PTs laugh. I always say, I am the treatment expert. And so that's kind of how I tell my PTs. And it's true. I'm like, you write great goals, you collaborate with me, you empower me, and I got the treatments down. So I'm like the treatment expert. This is what I spend all my time in continuing education, is just getting this treatment down, and I'm going to do the best for these patients. And that's what I bring to the table. So that's kind of how I roll. Shelby, I think you have your hand raised. Can I ask? Am I allowed to do that? Okay.
Oh, yeah.
Hi. I guess it's okay.
Thanks for sharing. As you can see under my name, I am a student physical therapist assistant. I attend CBD College along with Maya. First, I just wanted to say I'm very proud of you, Maya. I think the advocacy and just representing yourself and the college is amazing. I also see one of my other friends who's also a student, Harriet, has joined us as well. But my question is, I guess as a PTA and as a PT, I see that there are some other students in the room. What are some suggestions that you have to some of the students, whether it's PTs? I guess for my question specifically as SPTAs, what are some suggestions, recommendations that you have for incoming students? Or have you had interactions with students as a PTA? Or a PT?
I always tell my students, when you're going out into the field, be humble, but be confident, right? So like, what you know, they may not know what you know, but just present it in a way that's not confrontational, that's not arrogant, And I think the biggest thing I say is you've got to build that level of trust, because you can talk all day long about what you do, but when you go and you actually do it and then you show it, that to me is more credible. And then that builds that trust that you need in a great PT-PTA team. So the biggest thing is I just say humble, but stay confident. Like, be confident in what you can do, because there'll be some PTs that will try to tell you, no, you can't do that, or no, this isn't within your scope, because they don't know. So, I say be confident in what you are, and then just really, you're trying to be creating a very good relationship for the patient. And I always say at the end of the day, you're trying to do what's best for the patient. So go into it, not an ego thing, not a you're right, I'm wrong, you're vice versa. It's about, you have a job to work together for the patient's best interest. And so that's my advice. Margie, what about you?
I definitely love what you're saying, Brenda. The difference between confidence and like just building it is practicing things. They say you don't learn something until you've done it, was it like 10,000 times or something? I mean, you guys I'm sure students can attest to that by getting ready for practicals, right? Those lab practicals, getting ready for clinicals. You're going to do a sit to stand pivot transfer 100 times, before you get tested for it. That's how you build confidence. You should be able to do it, without hesitation. Now, does it mean that you're going to do it perfect every time? No, there's no such thing as perfection. As clinicians, I can confidently say that my transfers are not perfect. In home health, a million things could happen. So it's the fact that you are in control, you stand your ground, you know what you know, and it's okay to not know something. Go back to your supervising PT, your interdisciplinary team, and ask questions. I think that is a big thing people forget, whether PTs or PTAs. It's like we have this imposter syndrome, like I have to know everything. I passed my board, I got a degree, and I've been only practicing for about 4 or 5 years. Brenda has a few more extra years of practicing, just 2 or 3, right, Brenda? We don't know everything. Your PTs don't know everything. Your directors and managers don't know everything. Things are changing every day. COVID is a prime example of that. So we are always learning. That's why we're lifelong learners. We take continuing ed. We renew our license every couple of years. Your confidence is built by practice. And it's okay when you have to get hands-on and practice with a colleague because you're switching settings. You've never heard of this type of treatment. You don't know what this diagnosis is. Lean into your team. Don't think that they're going to not be there for you or be helpful, because that's what, like what Brenda said, we do what's best for the patient.
I think that this isn't specific to like the PTA PT relationship, although I do think one of the things that I love about where I work, and that imposter syndrome is real. Like it really is. And I think that you have it at times in your life wherever you go. One of the new PTs that we have working with us, she's been there about 3 or 4 months now. She specializes in strain counter strain, which I had no idea what that was. And so they had we had an in-service where she kind of like went through that treatment was. But one thing I love about her is that she keeps a binder with her and goes through, like when she's working with a patient, she has her binder, she's flipping through pages, she's checking up to make sure that she's doing something correct. I have another PT that we work with, Michael, he does the same thing. He has notes out. And I loved their confidence in being able to go back to something that you learned somewhere else, whether it was in school or something else. I have just a page on my notepad that has like all of those, the normal range of motions. I don't remember these things. It's like, I don't have any, which I have to go back and I just flip through them and just like, okay, yeah, we're in a good spot now. I think that it's really helpful when you witness people acknowledging their imperfection, although I wouldn't say that it's a perfection to know it, but there's an expectation that we have on ourselves that we should always know these things. And I like that you could see somebody who has more experience than me going back to paper and being like, all right, let's take a look at what we're supposed to be doing here.
Definitely, like Shelby put in the chat, we're all human, and it's definitely humbling to realize that even PTs utilize those resources as well. Rebecca, I see your hand is raised, so we'll take your question.
Hey, thank you. Thank you so much for doing this tonight. This is really exciting. My name is Rebecca Shikoski. I'm actually a PTA and an educator. So, and obviously was a student at one point in time. So I'm really thrilled about this. I talk to my students a lot about what I call essential professional or essential clinical skills, but like soft skills. I hate that term because they're not soft, but I think about what is the one or two most valuable skills, specific skills that kind of contribute to the things you guys have been talking about building a good collaboration with your PT or your PTA or just your team in general. I'm interested to hear what you guys find as your like go-to skill.
Is that for me, Rebecca, or is that an all skate for everybody?
It's an all skate. I'd love to hear all of your opinions there.
Okay. All right. So I guess my biggest go-to is it all goes back to communication. Like I am like a firm believer in communication. And so I'm very careful on the word choice that I use when I communicate to make sure that it's a collaborative, like what do we want to do with the patient? Here are what, I was thinking, what are your thoughts? Just constantly opening up that communication. And then I like to talk. So I always have to take a pause to listen. So for me, over the years, somebody said this to me about one of the PTAs said this about me. She goes, well, you're scary. I'm like, scary? She goes, well, yeah, you're very confident. You talk a lot and you talk over people and they're very afraid of you. I'm like, scary. And so it was an interesting perspective. And so then I kind of reflected on that. And then I recognize it's my passion, right? And so not everybody likes that form of like intense communication. So I've learned to kind of read the room, meet my partner or anybody on that same level of communication. So that way I'm giving and I'm receiving it and it's not just the Brenda show. So I think that's my biggest one. Margie, what about you?
I definitely agree on communication, but I also want to remind you how when you were in school, you learned what your learning style is. Revert back to that. Not everybody learns the same way. I'm a very kinesthetic and visual learner. So if you're on the phone talking to me about certain treatment, it's probably going to go in one ear and out the other. But also learn how your peers, your colleagues, and coworkers learn too. I think that things can be taught in many different ways. And that way we are on the same page for this patient or for this diagnosis. So just keep in mind, not everybody receives information like you. Like for me, I put a big line on home and work life. 5 p.m. Friday. Do not expect to email me or text me and get a response Friday through Monday. I'm off on Mondays. So knowing that and making that very clear ahead of time, I tell people, I'll get back to you Tuesday, 8 a.m., whatever, but also making it clear to set your boundaries too, so that you're not burnt out. I think a lot of us can speak about that, whether you're a student or a clinician. Set boundaries, and it is okay to have healthy boundaries with your boss, with your peers, with your colleagues, with your family, because this is what's going to work for you.
I'd say that, I've had a lot of experience in consulting situations. And I think that when it comes to patient care, it's the same. I have found that my relationship building with my patients is my strongest thing. I think that there's a acknowledgement that sometimes we're not perfect, but we don't feel that way all the time. I do storytelling. I let my patients know what's going on in my life. Like, we're remodeling our house right now. So I'm in a townhouse that there are boxes of everything. Just, we're living out of boxes, and it's incredibly stressful. It has impacted absolutely every aspect of my life. We have our Peloton bike over there. I think that it's been ridden twice since we've been here, because there's no motivation in it. The kitchen is small, and we get it's just difficult to get excited about cooking. We're not eating healthy. And so I talk with my patients a lot about what's going on in my life as a way to make them feel as if they know me better, which allows me to then learn more about what's going on with them, which helps my documentation for subjective matters. And I remember, I want to say it was maybe last January, one of the PTs was like, "Ted, I just want to tell you that I love your subjectives." Like, when she goes back and does chart reviews, she's like, "It sounds as if the patient is actually talking to me." And, I think that having that relationship with the patient makes you more valuable to the team as a whole. Sometimes it's almost it can go too far. And I know that you learn about this in school, about having that relationship where I'll have a patient who doesn't want to work with anybody but me, but that's not a good team relationship. You want the PTs to be there. You want to have a break from the patients sometimes. And I think that, like, being able to have those communications and having that conversation with the PTs about, so-and-so is seeing me again. Can we get her on a different schedule, or get him onto a different schedule, so that there's a different opportunity to learn more, because they become comfortable with you. Like, I like that I work in a clinic where we rotate people through and you see multiple therapists as a patient. I think that, but having that patient bonding is important, but you definitely want to keep it professional and not let it become where they only ever want to work with you because they think it's a social visit, not a therapy session.
Awesome. Thank you, everyone, so far for the interaction and raising your hands to ask the question. Real quick, we're going to have a brief interruption from nominating Chair-elect Sophia Hack, who will make a few announcements about upcoming events happening in the APTA.
Thank you, Maya. So first and foremost, we would like to congratulate our two APTA Outstanding Student Awardees, Madison Henry from the University of Kansas Medical Center and Angelica Irwin, SPTA, from the Community College of Rhode Island. These APTA scholarships recognize one DPT and one SPTA per year, with a $1,000 and $500 scholarship respectively for exceptional overall accomplishments and contributions to the APTA and the physical therapy profession. Applicants must be currently enrolled in their final year of school, and they must be current APTA members. Nominations open September 1st if anyone's interested in nominating a student or even nominating themselves if you are a student. And applications will be due December 1st of every year. So if you're interested or you want more information, go ahead and hit the link in the chat that Tyler just dropped in there. Second of all, applications just closed for the APTA student board. So be on the lookout on @APTA students on Instagram and Twitter for the announcement of your slated candidates, which should be coming soon as well. And then House of Delegates. is only 3 weeks away, so get excited. I'm going to pass the mic on to one of our student delegates and fellow nominating committee member, Tyler, to talk a little bit about it.
Hi, everyone. Thanks, Sophia. Like Sophia said, I'm one of the student delegates along with Kaylee Bates. Unfortunately, Kaylee wasn't able to attend tonight, but I'd like to inform you that House of Delegates is less than a month away, so 3 weeks, as Sophia just said. The House of Delegates is where our professional advocacy happens. And we have 2 students, myself and Kaylee, who represent all the student or the entire student voice, which is about 30,000 students. Over the next few weeks, we'll be breaking down the agenda points for this year's House of Delegates on our Instagram page. And it's so important that Kaylee and I hear from you all because we want to know your thoughts and opinions on these matters so we can represent you properly at the House of Delegates. If you'd like to get more involved, I can add you to our group meet for the House, which I'll be posting here in the chat momentarily. And if you have any questions about the House of Delegates or any opinions, please message me here or you can reach out to Kaylee. Thank you.
Awesome, Tyler. And also, if you can't make it to DC in person, there will be a live stream of the event, so keep an eye out for that as well. And as I alluded to before during the little introduction that we had, during the breakout room session today at the end of this social, we highly encourage you to go through the questions in the article that I'm about, or that Tyler will drop in the chat, to get to know each other and see how much you truly know about your PT-PTA counterpart. I highly recommend that you go through that. It can be a good little icebreaker as well to kind of get to know people. So we'll be doing breakout rooms at the last like 10 minutes of this event, and be sure to check that out and maybe ask a couple questions to each other. I'll now pass it back to Maya and we'll continue on with the social.
Awesome. Harry, I see your hands raised. If you want to ask a question, that'd be awesome.
Hey guys, my name is Harry and I'm a student physical therapist assistant as well. May I just ask for some advice or wisdom for new SPTA's involvement in the APTA for those of us who may not know where to begin?
Oh, that's a great question. I tell my students to show up. You got to show up. If you're looking within your chapter, or what do they call it, or component, those words are interchangeable. I always like to say that because when you start getting out into the big dogs, they say component, you're like, what's that? Chapter and component are the same thing. So the place that you treat, the state that you treat, most of them have some kind of a governance body. So I would just show up and start getting involved on the state level, 100%. For SPTAs, for students, for PTAs, there's also the governance structure of the caucus. So the PTA has a caucus that is the same as what Tyler was talking about, where the students go to the House of Delegates, the PTAs go to the House of Delegates. Every state has a PTA caucus representative. So Ted is a PTA caucus representative for his state of Virginia, and every state has one. And then those 50 leaders will go and meet before the Leadership Congress and have a business meeting, and then we'll also attend the House of Delegates. And within the House of Delegates, there are 5 PTA caucus delegates that are voted on and elected within the caucus reps. And that's the structure that goes. And 2 of those are the voting body that actually go in and vote on the motions within the House. So I know Ted is a great story of how he just kind of got in when he graduated. I mean, he can tell you a little bit more about that. He actually was very active as a student within the student SPTA, and he actually joined our calls. So the students were broken up into the different regions. So he was in Virginia, he was in a region that I was in, and he would participate in our calls as just a guest listener. And then he got like, hey, what's this caucus reps thing going on? And then he ran for that position. And then he is now a PTA caucus rep for his state of Virginia. So there are leadership structures within states. I can't speak on all those. I do know that APTA loves PTAs, and all of the states love PTAs, and they're always looking for ways to get involved. And sometimes if you don't know, you just show up. And I just always show up and say, hey, I'm Brenda. And I just talk to people, go figure. I kind of work the room. You know, sometimes there's committees, you know, things that I'm interested in, and, you know, just kind of network. And I think within what the students have. They are really good about plugging, especially student SPTs into the rep positions and into the governance. And that's one way. And then engagement groups are on the cusp. We'll hear more about those. So there's just lots of great things. You just got to kind of show up and just say, hey, I'm here. What do you got? And go from there.
Yeah, thanks, Brenda. I'd say that what got me into it immediately, and I had actually, I want to say, agreed to be my school's student liaison with the student assembly in Virginia before I actually started school. Like there was a call out or something like that looking for student liaisons from each of the schools within Virginia with the PTA programs. I started off with that. I had no idea what I was doing. You never know what you're doing, and it doesn't matter that you don't know what you're doing. The important thing is that you're trying to do it. But I had a past experience where like some of the most impactful changes I made for my clients were at the higher level, that I had to work through an association in order to help change the federal accounting standard laws in order to help my clients become auditable. That was one of the most important things, because you can only help one patient at a time in your services when you're working with a patient. But with the association levels, you can help thousands of patients by being involved. You don't have to know what you're doing. I'd say everybody's tolerance for their involvement is different. Don't feel as if you have to go all in. Attend your local chapter meetings. Mine just happened to be on the nights that I work, so I can't make it. But those are like the first things, just to get involved, just volunteer. The initial fear, you get over pretty quick once you're there, because you realize, okay, I don't know what I'm doing, but I'm here to help. And then you get pulled into it. After I became the Virginia, there was a Virginia Communities College liaison with the state student assembly board. Then they pulled me in to be the SPTA rep on that executive steering committee. And then that following November, or that same November, I guess, I went to Virginia's annual meeting and helped run their student caucus that they had. You don't know what you're doing, and it's fine. But just being willing to try, I think, is the biggest thing, and go with whatever comfort you have and see where it takes you. I will say that momentum, though, the more you look for opportunities, the more opportunities find you. I ran to be the PTA liaison with the student body last year, 2 years ago, and lost. But because I lost, I was also just, I think that Lisa McLaughlin was like, well, there's another opportunity that we're working off, and Brenda mentioned that to be the student liaison on the PTA caucus meetings, and I'm like, sure, I'll do that. That would be great. So you just find yourself into positions the more that you start that momentum, and I think that that's something that anybody can do at any level, and just go with whatever you feel comfortable with.
Harry, can I ask what state you're from?
I'm in California. I actually attend the same school as Maya as well.
Oh, okay. Yeah, I was like, California is a very PTA friendly state. I would start, I don't know if California has it, but in Virginia, we're a little smaller than California, but we have districts. So I'm part of the Northern District, which is closer to DC. We have Tidewater, which is south, closer to North Carolina. So there should be smaller groups within your state's APTA chapter. I would say as a student, you guys now have awesome discounts for conferences, for any big meetings. Go out there, do the networking, do the happy hour. They may not remember your name, but they'll remember your face. As a student, I went to like almost all of the VPTA meetings, the monthly meetings, to the point where like, they're like, oh yeah, you're Margie. But it took them like, a few years to remember my name, but they would see my face over and over. You never, in this field, especially as a PTA, if you want to grow, whether it's in leadership or something, it's who you know. If you believe that you're just a PTA, then you're just a PTA. But if you want to do more, network, talk, do it small, get on social media. APTA has a page called APTA Engage where you can volunteer and do stuff. Some stuff is with like the magazine and publishing stuff. They'll ask if you want to write an article, they'll interview you, or they'll ask for volunteers to come do some event. Just be on the lookout. Following your state's like social media pages is also good, but really like what everyone else said, Ted and Brenda, put yourself out there. Don't worry about, you don't have to know what you're doing. It'll create a lot of opportunities. So don't be nervous. California is great. And next year, that's where CSM is. So I really suggest you take the opportunity to go to CSM. It's the biggest PT conference each year. It's in San Diego this year. And who knows, maybe you'll bump into me, Ted, and Brenda. So definitely put yourself, we're going, okay?
Yeah, we'll be there.
California, count me in because it's cold as heck in Virginia.
We'll be there.
I'll be there.
Yeah, you show up, I fake it till I make it look nice, and then your excitement, your engagement, like Margie says, will remember you. You just keep showing up, and then you'll figure out, like, talking to people and figuring out is like, oh, maybe a committee's where I can start, or maybe I have more time for leadership. Because, I will say, as students, you've got your whole career ahead of you, and then you want to volunteer and go into leadership. So you have to figure out that balance, right? So, some involvement requires a little bit more time and commitment. So, just take it slow, get in there, do a little networking, and figure out where your time and resources are going to most be impactful. And then there you go.
Yeah, I love the showing up part, because that's what I've been doing, is just showing up to these webinars. I attended a PTA social through APTA about the Centennial Scholars, showing up, and everyone's names are now familiar. And now we're having this event. So it's a great recommendation.
Comment, Maya, is that if you guys have student special interest group, aka SIGs, definitely look that up in your state. That's another great thing. I was a PTA rep for the Virginia PTA SIG. It was a very long title, but that's another great way to get started. But also remember, like, me and Brenda have different passions, right? Brenda's really, really good with legislation. For me, it gives me a headache. I don't follow well with, Article 1, Statement 2, blase, blase, blase. I am very passionate about DEI. I'm a woman of color. I'm a minority. I am first generation. DEI is very important to me. So that's where I'm gravitating to. Thank you, Patrick. And so find your passions, because there are smaller subgroups in APTA. You find your community, find your niche. It might
find your tribe. You find your tribe. That's what they say. Got to find your peeps. Got to find that tribe. Yep. Hang out.
And I think the biggest thing right now, we're still in COVID, social media will connect you with so many people. Social media connected me with Brenda, and Brenda connected me with Ted, and APTA kind of follows me now. So social media is huge. So if they don't have something created, don't be scared. You are your voice. You have a representation here, and I would love to see some more diversity in each section.
Thank you. Diana, did you still have a question? I saw your hand raised earlier.
Hi, Maya. I think that it was kind of touched on in this last question. I asked as an SAT student.
Diana, you're breaking up a bunch. If you want to put it in the chat, and then I could ask it for you. Sorry, thank you. Awesome. So while she's putting that in the chat, my just a leeway was the leadership positions. And I know leadership means something different for everyone, as Margie already said. So I wanted to ask all three of you about the opportunities for PTA and leadership roles, whether through the APTA or being an independent contractor. Margie, there's so many options. So I would love to hear your responses.
Leadership roles is what you make of it. Leadership does not mean you're a boss. Leadership just means that you're willing to serve. And I think somebody that's really good at this is Brenda. I look up to her. If you're a PTA and you don't know Brenda, you're in big trouble. Brenda is the VIP PTA.
You're so funny.
Because when I had her on my Instagram live, my DMs blew up. You have Brenda coming on your page? I'm like, who's Brenda?
It's only because I've been around for a real long time. That's all. That's all it is.
Leadership is what you make out of it. If it means that you're going to, like for our local chapter, we are big on the Parkinson's disease. It's an organization that raises awareness. Every September, there's a walk at Nationals Park to raise awareness, and we're very involved in that. Leadership could mean small. You don't have to be the face of everything. I think leadership is intimidating sometimes because you think you have to get your ish together and you have to know everything, and you don't. You just have to be willing to serve.
Mm-hmm. And I would agree 100% with Margie. You know, it's every organization, you know, within your chapters have different leadership opportunities for PTAs, and what that is, you have to figure that out. You know, in Florida, much like Margie was talking about in California, their districts. There's 6 districts. Each district has a PTA district rep. There's a PTA board of director position on our board at FPTA. So there's board positions for PTAs. I can be a regional director of a district. I mean, there's tons and tons of opportunities if that's your passion. Much like Margie said, I mean, you know, sometimes it's just being part of a committee, right? But then being a leader within that committee. We had this horrible committee that I volunteered on self-servingly because I wanted to make sure that PTAs were well represented within this policy and procedure manual. And so it was me and a PT that was very well renowned within our association, and we became co-chairs. And so as her activities and things pulled her away, next thing you know, I'm the chair, and I became a leader of this wonderful policy and procedure work group. So like Margie was saying, it wasn't that I was well, Brenda's a leader. I became a leader because of my ability to organize and create that opportunity for me to be able to help out. Because again, at the end of the day, it's not an ego thing. And I always look at this too, and I tell this to my kids a lot too, like you have to, like if you have something to contribute and you're passionate about it, then do it. But if somebody else, you know, has got a bigger passion for it and they have the skills, that's okay. You can just be part of the team and you don't have to be that leader. So, you know, again, it's not always being the face out there. Sometimes it's being the worker bee. You know, like Margie said, you know, governance isn't her thing, but she'll tell you 100% social media. I'm a hot mess when it comes to social media. So we can talk all day long about that. Don't ask me how to go into a live chat on Instagram. But anyway, so leaders, there's just out there, you just have to push and you have to find them out what they are. And then of course, obviously on the national level, the PTA caucus is there for the PTAs. The Engage is a great opportunity. When I started it, I was on the honors and awards subcommittee. There was a opportunity for people to apply. And I went on the Engage site and I went ahead and I said, hey, this sounds like a fun committee. And so I was on the Honors and Awards Subcommittee for APTA, and I read all these great resumes of things that people were doing, and I contributed my time and my service in that way. So it's just a matter of figuring it out and then going out and finding it.
Thank you. Ted, I think the question in the chat might be perfect for you just because you were involved as a student as PTA. So this is from Diana, who is actually involved with the California Student Special Interest Groups with me as well. She's a secretary, knows the ins and outs of California involvement. But her question is, do you have any advice for engaging SPTAs in SIGs aside from blasting information on social media? It sounds like there's many students out there who want to get involved but don't know how. And on the other side of things, student SIGs are actively looking for people to get involved.
Yeah, I think that the student SIGs have it's a tough task, especially for the PTA students, since it's a 2-year program, and the population of the students that enter those programs I think are probably more diverse than the DPT programs. We had in my cohort age range from like 22 to 60, I think. Many of us had, or several of us had children. Many of us had like past careers, and it's difficult to identify which population needs to be engaged and how to get them there. I do think though that having the PTA PT combined portion of it is probably where the most value can be had, to help share the understanding of what happens within each program. I think that'll pay dividends downstream. At the state level, it's still difficult, because especially at a state as large as California, maybe you break it down into the regions. Virginia is a bit smaller, but even that, we would just within the school try to like team up with one other university and have that relationship, to have PTAs and PTs talk to one another through a meeting like this. I don't know that there's what the right bait is. I had gone back to school last September to talk with the cohort that was entering their last year, I guess, to encourage them to get involved. And I went back to the centennial presentation that was given at APTA. I guess it was the centennial celebration. I don't remember what it's called. And it talked about like how broken healthcare is. And it said that, in order for us to make a change, I mean, we are doing this because we want to help people. And in order for us to change that healthcare, we have to be involved. The voice has to be larger than what it is today. And I tried to get people to get passionate about it from that standpoint. I got into this to help people. It is purely it. The measure of success within consulting is largely financially driven, and it doesn't have not for everybody, but like there's a bit of it that just feels kind of hollow. But the measure of success within physical therapy is your patient being pain-free and getting back to their life, or having a better standard of living. And I think that getting that image of like, we have to do better as a collection, as all of us, in order to help healthcare change, because it desperately needs to change in our country. And I think that the DPTs, you guys, the DPT students, you guys have probably the biggest impact on being able to change the way that patients look at physical therapy, because you can be the one that gives annual physicals to patients and help them, not when they're in pain, help prevent it downstream. I think that is a part of healthcare that we just don't do. And it's the DPTs you guys are prime position. If I had any regrets, that I should have changed careers long ago so I could do that and make that my career. All right, Margie, I want to let you take this.
When I was the PTA rep for my SIG, I went old school, straight cold calling. I went on the CAPTI website, looked up the PTA programs in Virginia, found the email correlated to the program. And I don't know how many schools there are now, but it was like 10 to 15. I emailed them, I introduced who I was and what I'm trying to do. And if there's like a student representative, a PTA president, somebody that could be my point of contact in the PTA program, I would tell them, like monthly updates or quarterly meetings that we're having, conferences, that sometimes you have to put in a little bit more work because it's hard. I definitely see what you're saying, Diana. There's definitely like a gap. There's students that want to get involved, and there's the set organization, club or activity, whatever, that needs students, that need volunteers. Like this gray area, how do we get there? Social media can get you so far, but not everybody's on social media. Not everybody has all 10 platforms. I sure don't post anything on Facebook. I will never see it. So I think it's just going back to old school cold calling, or emailing as you would call it, and just try. I love what Ted said about the DPTs and PTs taking initiative. My program, we do I think it's yearly case study with the local DPT program, which for me, I went to Northern Virginia Community College, and our local DPT program is Marymount. We teamed up for one day to do a case study to show how to collaborate together. And I wish more PTA and DPT programs did that. And sometimes it's not, why not? It's why not you? Well, I saw how effective that is. So I reached out to other local DPT programs here. We have GW, we have Howard, Shenandoah, VCU, ODU. This is just Virginia. And I asked them, like, how can you incorporate this so that there's not this dysfunction in the team, in the field, or in the clinic? I don't know how many times PTAs have, kind of come up to me and confess, like, I don't really know what you know or what you do. And I don't take offense because you don't know what you don't know. I think starting that conversation as a student, as a PTA, take that initiative can really, really help us change how healthcare works, change how this relationship works. So just taking that initiative, is it a lot of work? Yeah, it is. It is. But if you're passionate about it and you want things to change, you're going to have to do something about it. You can't just sit here and complain. Just like if you don't vote, you can't complain.
Yeah, perfect last words. I think before we head into our breakout rooms, thank you so much, Margie, Ted, and Brenda, and everyone else for being here today. If you three would mind sharing your contact info or social media handles, just so people can ask you questions in the chat, that would be awesome. I know I follow Margie, not just a PTA. I love the name. So thank you, Margie, and everyone, Brenda and Ted, for advocating for PTAs. Let's hand it off to Zofia for the breakout rooms, I think.
Thank you everyone for joining. So I'll give you guys a second just to screenshot everyone's contact information in the chat. And then Lisa, if you wouldn't mind breaking us up into our individual rooms so that everybody can go through those questions and get to know each other.
Sure. Just give me just a minute just to get those set up.
In the meantime, I'll drop that article in the chat again in case anyone lost it up there.
Zofia, I was trying to assign rooms to people, and I don't think that's going to work, and I'm having a hard time getting back to just the random. Hold on 1 second. I don't know if this is going to do it.
That's all right. Since we only have 2 minutes left technically in the event, and if it's too much trouble to get all the rooms situated, maybe I would just encourage everyone, if you know of a PT or a PTA counterpart, go ahead and try to go through some of those questions with them. Like I know one interesting one that I'm curious to ask is about like different textbooks that PTA students use versus what student physical therapists use. And what got my student PTAs interested in being a student PTA and future PTA.
Sophie, I'm getting there. I think everyone should be receiving some invites now.
Okay.
All right, let me hit open all rooms. Good luck.
All right.